Knock knock, it's Dr. Lindsay. Hi, I'm Dr. Ryan Lindsay. I'm a board certified pediatrician and I am a preceptor at ICOM. So I'll often listen on top of the shirt at first, just to make them comfortable. So when you're a preceptor, you're a physician and you'll invite or have medical students come be with you in your practice and do what you do.
I think what I've enjoyed most has been getting out and just being able to practice the things I've been studying about for the last 2-3 years now at this point.
Ooh, does it feel a little funny? With clinical clerkships, what I'm most excited about is actually getting a chance to practice all the hands-on stuff that we learned about in our first 2 years. You spend your first 2 years reading about patients and reading about diagnoses. I'm really excited to learn more and experience more, and it kind of helps guide you to what you're more interested in going into 4th year.
The clinical years start in July of your 3rd year. We have you here for a few weeks to help the final tune-up for clinical years, and then you start your clinical rotations at one of your core sites.
We do at ICOM like a clinical boot camp prep. So when you go out onto rotations, you're going to be expected to be thrown in and ready to go. So that includes things like starting IVs to help the nurses out and actually seeing a patient, being able to write a proficient note. And so our first rotation that we do is actually at the ICOM building, and we're just practicing all those skills and getting checked off and just going into it as prepared as we can be. So I'm really excited for that. It's been fun so far. It was day 1 today and we all got our big rotation list and we got to see who's precepting us. So it was a really exciting day and it really made me look forward to the rest of 3rd year.
You spend the 3rd year rotating with different physicians in core specialties, and those core specialties are explained on our website, and they're what you'd expect a 3rd year student to participate in. Family medicine, internal medicine, all the general medicine specialties to prepare you to be a well-rounded physician and a well-rounded resident.
You spend so much time in the lecture hall and at home studying from textbooks and up to date and various resources that it's nice to be able to get out and go, I actually understand some of these things that I've been studying, and getting to just understand patients and understand that they're real people and that you're here to help them, I think has been one of my favorite parts, is applying both of those things.
The time goes by really, really quick. So as the months go by, it changes slightly. Someone in their first rotation of the 3rd year, the first time that they're doing these clinical rotations, we ease them into it a little bit. And then just last week, we had someone on their very last rotation of the 3rd year. But the experience is the same, we vary it based on their experience.
The main players, however, the main folks involved with our students are the preceptors. These are clinical faculty that are either board certified or board eligible faculty members who are working with our students day in and day out. And students will spend at a minimum 32 hours a week with them. Generally, it's much more.
The one thing that I started to really do is I've been with ICOM since the very first year that they had students, and that was really important to me. I was in residency when the governor at the time had kind of made the moves so that we could get ICOM to come. Idaho needs a medical school to call our own, and super important to me that I wanted to be a preceptor from the very first year. It goes in your mouth and it goes down your food tube in your stomach.
The way that he was kind of feeling for the belly and the abdomen. With adults, we tell them we're gonna press down and rub around, and with the kiddo, he was kind of saying oh, this is how your food goes through your belly. So she didn't even know that he was assessing her abdomen for anything, and I really liked that. That was cool.
Show me all your teeth. It's an experience for each student to go to get a chance to see what that specialty's like, to see patients and examine them, to make notes, and learn about conditions of that specialty, while also getting the chance to build up their knowledge base, build up their experience, and just not only to decide if you want to be that specialty of doctor, but just to have a well-rounded experience where you really get to see all of medicine in the medical school experience.
I will be doing my clerkships in the Treasure Valley. Very excited about that. It was my #1 choice. I am actually from CUNA, so it's really cool to get a chance to kind of serve the community that I grew up in, and I'm familiar with the area, my support system's here, so I am so grateful that I got my #1 choice.
There we go, nice. I loved my rotation here at Ada Pediatrics. It was just a blast. Working with the kids that came in, was so fun, and seeing Dr. Lindsay interact with the kids too was just so inspiring because he always made the kids feel really comfortable.
We want to see you make a muscle real big like this. If anyone is going into primary care medicine, that's what we really like, you know? And we get to see a kid all the way growing up. And I'm getting to be old enough now too where like some of my kids grew up and now they're moms and they're bringing their kids in and stuff like that too. So that's the advice that I have is that, hey, you know, take it seriously like a job, and then, but never forget to like connect with your families.